Here in Rhode Island, the number of positive coronavirus cases has topped 1,000.
This is the count from the Department of Health. Now, they report 160 new cases today and 2 more deaths. So far, 27 Rhode Islanders have died from the virus. The number of Rhode Islanders hospitalized is now at 109. 37 are in the intensive care unit and 26 are on ventilators.
In Massachusetts, there are more than 1,300 new cases, bringing the total there to close to 14,000. The state also reports 29 new deaths. 260 have now died in Massachusetts from the virus.
In Rhode Island, Governor Gina Raimondo says a new drive-through testing site set up by CVS in Lincoln has effectively doubled the state's testing capacity overnight. Now, the governor says the increase in cases was again expected and what they've been expecting for weeks now.
Eyewitness News reporter Kim Kalunian joins us live from the State House with today's other developments. Kim?
Well, Shannon and Mike, today we learned about 1/3 of Rhode Island's coronavirus cases are healthcare workers. And we've also learned that more than half of the fatalities that the state has seen, 27 in all, 16 of those deaths have happened at nursing homes. And now the state is looking to consolidate all of those nursing home patients with coronavirus into a single location. This as state leaders work to track and predict the spread.
We have widespread community spread of the virus. Many of us are going to get sick.
Governor Gina Raimondo says state projections for coronavirus cases and deaths are now more aligned with models from the University of Washington. Researchers there estimate the state will see close to 1,000 deaths by August, though it's not an exact science.
If anyone tells you they know exactly when Rhode Island's peak is and what the number of hospitalizations will be at that peak, they're not being honest with you.
Raimondo thinks the state's cases will peak between mid to late April and mid-May.
But that changes every day.
On Monday, the governor renewing her call to Rhode Islanders to track their contacts. This as the state does some monitoring of its own.
We are using cell phone information. Publicly available information about people's cell phones allows us to track how mobile people are, how much people are moving. And as I said, last time I checked on that data a week or so ago, we were moving too much.
While health leaders try to stem the spread, hospitalizations are on the rise. Department of Health Medical Director Dr. Jim McDonald says some patients have received hydroxychloroquine, the anti-malaria and lupus drug.
We don't have data yet on how successful it's been in Rhode Island.
And on the economic front, a bright spot for independent contractors and gig workers who can begin to file for unemployment on Tuesday morning as part of the federal government stimulus package. And right now on our website, WPRI.com, we have much more information about how you can file for unemployment insurance.
Eyewitness News reporter Kim Kalunian joins us live from the State House with today's other developments. Kim?
Yeah, Shannon and Mike, the big headline out of today's briefing from the governor was that announcement about that new CVS testing site at Twin River Casino in Lincoln. It is free and open to all Rhode Island adults who are exhibiting symptoms. That's the key there, and you do have to pre-register at CVS.com. Again, that is doubling the state's testing capacity today. Also today, we got a show and tell from the medical director at the Department of Health, Dr. Jim McDonald, about a hot topic, masks.
So keep in mind, the cloth face mask is not a medical grade mask. It's just something made of cloth. It covers your nose and your mouth. It can be hand sewn or it could be a bandana, a t-shirt, or a scarf. Now, for members of our critical infrastructure workforce, this is something you really should be doing all the time. So if you're in the critical infrastructure workforce, and that's really a lot of people who are out there working right now, a good rule of thumb, if you're out there working right now, you probably need to be wearing some kind of covering over your nose and mouth. I brought my N95 mask with me today here. Time for a little show and tell, if you will, here. So this is an N95 respirator. I know we talk about these a lot. So we wear these in the hospital so we don't get sick, and we wear these when we're in front of our patients with aerosolizing procedure. It's a little bit different looking than a surgical mask, which I think is what most of us are used to seeing. But keep in mind, when the surgeon's wearing the mask during your operation, they're wearing that so their air that they exchange when they exhale doesn't infect the incision or the environment. So the point of a mask, the cloth covering and the surgical mask, is so that you don't accidentally breathe out, aerosolized particles so you get someone else sick or on an object. Remember we talked about this yesterday, the little fomites, those little viral particles that stick on the objects we touch. So we want to make sure that when you put the mask on, it's important to cover your nose and your mouth. So I'm putting it on now. Did you notice how hard it was to hear me when I put that on? You put the elastics on, and it fits kind of snugly when you're wearing N95. It takes a little getting used to, and when you're talking, you have to learn to talk a little bit differently. But when you put the surgical mask on or the N95, it should fit snugly, but you really want to cover the nose and the mouth, and then you know you're wearing it correctly, and that'll work just fine for folks.
So again, that N95 respirator that he was just demonstrating, not necessarily recommended for folks who are just going out to the grocery store or those essential workers who are going out and manning the grocery store or the restaurants. They should all be wearing some sort of a face covering, but the Department of Health says a cloth mask will suffice for those folks. Meanwhile, some good news today emerging from the briefing for unemployed folks who are gig workers or independent contractors. The governor says starting tomorrow morning, you too can apply for unemployment insurance through the DLT. We have much more information on that process right now on WPRI.com. Live at the State House, I'm Kim Kalunian, Eyewitness News.